Hello, I'm Dr. Leong, a consultant chest physician. This is an extract of a video recording from a webinar titled The Management of Cough and Excessive Phlegm. This video will briefly explain the pathophysiology of bronchiectasis and its management. Thank you.
So what is bronchiectasis? They have dilated airway lumen. They have thickened airway wall. There is abnormal mucus clearance, increased mucus production, and subsequently recurrent bacterial infection. So this is a cartoon showing the normal airway, rather smooth, regular shape, and there are a lot of cilia, small cilia, which helps propel the mucus up the airways. All right. Whereas in bronchiectasis, the walls are irregular, they are dilated, the wall may be thickened, and there is abnormal production of mucus. That means there are a lot of mucus in the airway, and they are collected there because of the absence of cilia. So without the cilia, the mucus cannot be propelled upwards. So they are retained in this airway. So we need to have physical methods to bring this excessive mucus deposition out of the airway. So this is a lung specimen of a person. And then you can see that they dilated airway and thickened airway as well. Thickened airway, you can see that, right? And then sometimes, if one doesn't take care, the whole thing can be destroyed and become cystic. You see, the whole place destroyed and becomes cystic. And this becomes known as cystic bronchiectasis. All right, you can see big cyst because this person has not been clearing the phlegm. So you must remember, you can see these large to medium-sized airways, but there's many smaller airways, So if one says that you can produce maybe 5 mils or 10 mils of phlegm, how many small airways are being blocked by them? So when they are blocked, they become inflamed, then disease sets in. And then after many years, they become cystic like this. All right, this is how it becomes cystic like in this picture. All right, and worse will be accumulation of mucus. Here is a chest X-ray. It's a bronchogram where we put dye in the person's airway, and you can see this fluid collection, the air fluid level, like in a glass of water, you can see the air fluid level, right? So you can see air fluid levels in all these cystic places. All right, this is not good. All right, management. So we need to do airway clearance techniques. Okay, airway clearance techniques to bring out the phlegm. Proper hydration is required, proper nutrition, physical exercise for general well-being, antibiotics when necessary, cough medicine, vaccination, followed by doctor regularly to see progression of disease, and surgery for selected cases. Airway clearance techniques. Now, this is very important for people with bronchiectasis. We always tell them they need to do it regularly, daily, maybe twice a day for life. It's a for life practice, So chest physical therapy comprises of active cycle of breathing technique, ACBT, autogenic drainage, postural drainage. All right. And there are aids using the PEP devices, vibratory PEP devices like flutter, acapella, aerobica, and high frequency oscillators like the West.